Good evening, ladies and gentlemen. I am Dr. Arun, Senior Consultant Gastroenterologist and Hepatologist. It's indeed an immense pleasure for me to meet you all once again in our Gastro Forum after a brief gap. And today I would like to disturb you all with the most disturbing entity in the field of gastroenterology, which is none other than irritable bowel syndrome. What do you mean by irritable bowel syndrome? Actually, in a normal person, you will be going to the toilet once or twice in a day. And suppose if you suffer from irritable bowel syndrome, you may go to the toilet more than 5 or 6 times in a day, or sometimes you will not go to the toilet at all, and sometimes when you are going to the toilet you will be having pain abdomen, always you feel uncomfortable, your bowel will be in an irritable state. So that is the reason mainly for irritable bowel syndrome. Actually, when you are going to the toilet, you may go around 5 to 6 times, or sometimes you may not go at all. You may go increased quantity, sometimes it will be highly watery, and sometimes it will be like a solid consistency, it will be like a rock solid. When you are going to the toilet, you will be having severe pain also. So most of the time, this, even after passing the stools, you will be spending most of your time in your toilet. Even after passing your stools, you will feel incomplete evacuation, which means always your mind, your bowel will be in a disturbed state, and it will be keep on disturbing your routines, your daily activities. So you'll be spending most of your time in the toilet. And this kind of presentation, you all should know, it may last up to 3 months. Some patients it may go up to 6 months also without signs of improvement. And for these kind of symptoms, you will be consulting with multiple doctors without any signs of improvement, and you'll be taking plenty of medications without signs of improvement because you are not analyzing. Most of the patients with this kind of symptoms will not be analyzed properly because irritable bowel syndrome, it is one of the toughest entity to treat even in the field of gastroenterology, even for the gastroenterologist. So it has to be diagnosed properly in a proper manner. That is the most important thing to tackle with irritable bowel syndrome. So how does it usually present? So if you are, what are the common reasons for irritable bowel syndrome to precipitate? So suppose if you are going to eat plenty of carbonated drinks, suppose if you are frequently consuming lots of cool drinks, if your diet containing high carbohydrate level, that means you are going to take plenty of lactose, plenty of milk, high carbohydrate based diet, highly sweetened diets if you are going to consume, and if you are excess alcoholic, and if you are taking plenty of outside foods, plenty of junk foods, if you are not going to eat your food in the right time, or even if you are too much stressed or too much depressed, even during your routine office hours, during a busy practice, in the early morning hours, you will have worsening of these symptoms. You may notice that you will be spending most of the time in the toilet. Even after going to the toilet, your bowel evacuation will be incomplete. And these are all the triggers, you should all know that. And next to that, and if you are going to use plenty of medication, suppose if you are having any diabetes or any other problem, and if you are going to take plenty of medications for diabetes without consulting the senior consultant, and if you are going to have any other problems, any other coexisting comorbidities, like, see, if you're having irritable bowel syndrome, always you should remember that some conditions will worsen that. Suppose if you're having any thyroid related problem, or if you're too overweight for your age, if you're obese, and if you're having any diabetes, any sugar related problems, or if the patient presents you with any metabolic syndrome, any other hypertensive, sugar related problem, this kind of coexisting pathology will worsen your irritable bowel syndrome most of the time. And if you're going to take plenty of antibiotics, if you're going to take the medications on your own, some patients will be having some mild symptom and they'll be going to the local medical shop and they'll be taking the medicines on their own, so without consulting the doctors. So most of the time, if you're going to take, it will affect your gut bacteria. If it is going to affect your gut, it's going to produce a gut dysbiosis. Dysbiosis is nothing but your gut microorganism, gut nature is going to completely collapse. So because of that, you may have the worsening of IBS and other pathology will set in. So always you should remember, if you are going to have IBS, you need to take care of your diet, you need to take care of your nutrition. Another part, you should not put too much of weight. You need to control alcohol, and if you are too much stressed, you need to control your stress, and if you are too much depressed, you need to control your depression and other activities. Everything has to be taken care of promptly. Only then the irritable bowel syndrome will be controlled in a proper way. That has to be diagnosed. See, when you're going to come to a gastroenterologist, what usually we will be doing, that we need to see whether you are having any organic pathology, because there are so many conditions mimic irritable bowel syndrome. Always irritable bowel syndrome, which means when the gastroenterologist is going to examine you, you will be having more of psychological component. Your gut will be normal most of the time. We'll be doing the baseline investigation. We'll be doing some baseline blood tests, and some patients we may do colonoscopy. Colonoscopy, do you know what is the indication for that? Suppose if you're having a worsening of symptoms for a long time, then we will do a colonoscopy to see whether you are going to miss out any other pathology inside your gut. We should not miss out anything. And finally, even after colonoscopy, even after the routine blood investigations, we couldn't able to pick out the most of the thing. Everything will be normal. And if you are even after that, if you are having this kind of symptoms, then we will be labeling you as irritable bowel syndrome. And as a gastroenterologist, we will be doing the routine clinical assessment before starting the management protocol, because you should always remember that if you're going to take some tablet for your gut, your problem is going to settle, which means it's not so, because this irritable bowel syndrome will always coexist with your gut, also your brain, because even if you are too much hyper-excitable state, even if you are too much depressed, even if you are in a joyful state, this syndrome is going to worsen. And always you need to take care of your gut, and you need to take care of your brain also. So if you're going to take any medications only for the gut, which doesn't going to have any impact on your irritable bowel syndrome, and your clinical status keeps on worsening. So we need to analyze you completely. We need to do a baseline investigations, and you should all remember that you need to take care of the treatment for minimum period of 3 to 6 months, even with the drug treatment. Drug treatment part is very minimal. We'll be giving some probiotics. Probiotics is nothing but if you are going to give some good microorganisms, then your gut dysbiosis, everything is going to be taken care of. See, not only because of that, your diet should be in a proper way, your nutrition part should be very adequate, your physical activity has to be good, your weight loss should be in a proper way, and always you should remember that irritable bowel syndrome will not happen if you are going to lose your weight without doing anything, and if you are going to experience plenty of blood, if you are going to pass blood in the motion, it's always an alarming picture. And once you go to the bed in the night time, in the nocturnal time, if your bowel habits is going to be worse, and suppose I will be seeing some patients in the night time, they will keep on spending most of the time in the toilet. So in the night time, if you are worsening of symptoms, if you are having blood in motion, and if you are going to have a significant weight loss, which is always an alarming picture, and the possibility of irritable bowel syndrome for that kind of patients is very, very low, and we need to look for any other organic pathology. It could be because of colonic cancer, it could be because of inflammatory bowel disease, or there are multiple etiologies there to look for the other differential diagnosis for your presentation. So if you are having irritable bowel syndrome, make sure your diet, nutrition, everything has to be healthy, stay healthy, and prevent irritable bowel syndrome, and control your diabetes well, take care of your thyroid related problems, and take care of your all the major issues. Consult a gastroenterologist early and reduce your weight in a proper way, so which will overcome irritable bowel syndrome over the due course of time within a period of 3 to 6 months, and you will be in a completely relaxed state. So overcome the irritable bowel syndrome in a proper way, check care of your health, and if you have any queries, feel free to discuss with me. Thank you all. Good night.